So you have a low back pain patient come in and their toe touch looks like this, okay? And then go ahead and start running through your stuff. So what would you do evaluation and treatment wise in order to get them better? Have you thought about doing Jefferson curls, or have you been told that getting out of lumbar neutral is a terrible thing? Well, we're doing Jefferson curls. We're also gonna do some other things that you're gonna see her do here in a second. The important thing is this is after we figured out what muscles were inhibited, not doing their job, and fighting her when she tries to do toe touch and squat with a butt wink. So what we figured out is one of the major problems was the muscle that does lumbar flexion and lumbar extension and lumbar rotation and lumbar side bending and hip flexion was not doing its job. So how do we get that muscle to get facilitated first? We did that on the table. Now we're reinforcing that new facilitation through a full range of motion doing these exercises. So Jefferson curl is limited because it's only one plane. So now we've got transverse aplanar motion going with chops. Go ahead and do squats. Then we went to goblet squats, making sure that she gets down as far as she possibly can to get butt wink, because that's going to get us into lumbar flexion. Notice on the chops, she was getting into lumbar extension with side bending and hip extension using that muscle that we had to work on. So these are the things that we have to do in order to improve toe touch and make her more functional with her ADL.